Hi everyone, welcome back to my channel. In this video we're going to talk about a very popular medicine called Omeprazole. Now if you have been prescribed this drug, chances are your doctor prescribed it to you under its brand name, which is called Prilosec. But whatever the name may be, chances are you want to know, what is this drug for? How does it work? What are its common side effects? And how should you take it? So if that sounds good to you, go ahead and tap on that like button, leave a comment down below, and let's get started. So let's start off with, what is this drug used for? Because chances are, if you have been prescribed this medication, you probably have some type of problem with your stomach, right? Well, in general, this medication is part of a group of drugs called proton pump inhibitors. Proton pump inhibitors are commonly used to reduce the amount of stomach acid that your stomach makes. By reducing the amount of stomach acid that you make, it helps heal the esophagus from the damage done by the acid. In addition, it prevents new damage from happening. This class of medications has been shown to be very effective at treating conditions such as GERD. It's also known as acid reflux, where the stomach contents, the acidic contents, back up into the food tube or the esophagus, causing heartburn. It is also highly effective in healing ulcers that may be present in the esophagus or in the stomach, and it can help prevent these ulcers from coming back. In addition, it can help prevent the complications associated with these ulcers, such as bleeding or perforation of the stomach or the esophagus. In addition to reducing the amount of stomach acid, these types of medications also boost the amount of alkaline mucus that the stomach produces. Alkaline mucus protects the stomach lining from the effects of stomach acid. The combination of reduced acid production plus an increase in the alkaline mucus secretion helps heal the stomach faster, and it keeps it protected from further damage. Now, there are many different proton pump inhibitors available. Some of them include medications such as pantoprazole, also known as Protonix, esomeprazole, also known as Nexium, and lansoprazole, also known as Prevacid. There are others, but those are some of the most common ones. The way they all work is the same, but they do have some differences in terms of their side effects and how long they last in the body. That's why your doctor may prescribe one over the other. So now that you know what it is used for, let's get into how it works. So like I mentioned earlier, this medication is part of a group of drugs called proton pump inhibitors. The word proton in this term refers to a hydrogen ion. Think of it like the H+ ion. So that's a proton, and pump inhibitor means that it inhibits or blocks the pump. Now you may be thinking, well, what does this pump do? The pump that this medication blocks is a specific pump found in the cells that line your stomach. These cells secrete or release stomach acid. So this pump transports hydrogen ions into the stomach to be secreted as stomach acid. By blocking this pump, omeprazole reduces the amount of stomach acid that's secreted. Now there are multiple proton pumps in each cell, and omeprazole binds to one of them. When it binds to the pump, it deactivates the pump. But here's the thing. The cells that line your stomach are constantly making new pumps. So this means that omeprazole has to constantly bind to these pumps to keep reducing the amount of stomach acid. So if you take this medication 20 milligrams once a day, it will reduce your stomach acid for about 24 hours. Now your doctor may tell you to take it more than once a day, especially if you have severe symptoms. Your doctor may also tell you to take it for a longer period of time. However, it's important that you follow exactly what your doctor tells you to do, because taking too much of this medication or taking it for too long can increase your risk of having serious side effects. More on that later. Now, another question that is commonly asked is, how do I take it? Do I take it with or without food? Well, it is recommended that you take this medication about 30 minutes before eating a meal. Taking it before a meal helps reduce the amount of stomach acid that's present when you eat. This is especially true for breakfast, since we usually have very little stomach acid present in the morning. In addition, taking it before a meal ensures that the medication will have enough time to work, so that you can have maximum benefit. Also, remember that this medication can cause side effects such as headache, diarrhea, and nausea. If you do experience these side effects, they tend to happen within the first few weeks of starting the medication. If you do experience side effects, make sure to talk to your doctor. Now, are there any side effects that I need to be aware of? Well, like every other drug, it can cause side effects. However, not everyone will have them. In general, most of the side effects that it can cause are mild to moderate, and they go away when you stop taking the medication. The most common side effects that it can cause include headache, nausea, vomiting, diarrhea, abdominal pain, and constipation. Rarely, it can cause more serious side effects. These can include low potassium levels, inflammation of the pancreas, weight loss, depression, hallucinations, dizziness, and suicidal thoughts. If you experience any of these side effects, make sure to talk to your doctor immediately. Remember, just because something is a side effect doesn't mean that you will have it. In fact, most people who take this medication don't have any side effects at all. Are there any side effects that I need to look out for? Well, yes, there are. Over time, it can weaken your bones, increasing your risk of having a fracture. This risk increases the longer you take it. Also, if you have chronic kidney disease or chronic liver disease, taking this medication can worsen your kidney and liver function. So it's important that you talk to your doctor if you have either of these conditions. Now, is this medication safe to take if I have liver disease? Well, in general, if you have mild to moderate liver disease, it's likely safe for you to take. However, if you have severe liver disease, your doctor may not prescribe it to you due to the increased risk of side effects.
Now, who should avoid this medication?
Well, in general, people who have taken this medication for more than 3 months should talk to their doctor. That is because taking it for longer than 3 months may increase your risk of having serious side effects.
Make sure to talk to your doctor about the benefits and risks of taking this medication for longer than 3 months.
In addition, if you are taking other medications, it may interact with them, changing how they work. Always make sure to tell your doctor everything you are taking before he or she prescribes you a new medication. This includes prescription medications, over-the-counter medications, supplements, and herbal medications. It can also interact with certain foods. Make sure to talk to your doctor about your diet to ensure that this medication will interact with any of the foods that you eat. Alright, now here's the important part. Don't ever start or stop taking any medication without first talking to your doctor. That includes prescription medications, over-the-counter medications, supplements, and herbal medications. Also, don't take someone else's prescription medication. It may not be right for you. I hope you found this video helpful. If you did, go ahead and subscribe to this channel, hit that like button, and leave a comment down below. As always, thanks for watching, and stay healthy.